We're one of the lead sites for Healthcare Home Initiative, but also our board decided or directed us that they wanted us to work on an initiative that targeted chronic disease prevention. So we took a number of our clinical council members to Sydney because we have such a large PHN patch. We took them to Sydney, and I honestly thought as a nurse they would sit there in the room and tell me that it's appalling they don't get paid to do preventative healthcare on our younger generation. I really thought that they would want an initiative targeted at somewhere where we don't have an MBS item number. I was absolutely floored to leave the room when they decided they wanted to work on healthy weight. So we've embarked on this, we started in last August, and it's been a very, very exciting time. What we've found when we're speaking to our communities, so we've decided to go into 5 local government areas right across our patch, and when the slides do come up, I can show you. We could have went into any community, any local government area right across our patch and ran this initiative, because in every single community we have high rates of obesity and overweight. So we picked 5 lucky areas where we've had a great community response and also clinical response from the communities. We're going to Cessnock, Wyong, Taree, Narrabri, Bogglebri, all those little towns. I do need my thing, but that's okay. So what we did, the other badge that we're not proud of as a PHN, and I would love to show you where you sit, because nationally we are the 3rd fattest PHN, and that's not a badge we wear proudly. So we really wanted to work with this initiative to address overweight and obesity. So we've had a range of clinical meetings with our GPs to say, how is it you can help, or how can you target obesity? What's working, what's not working, and what can we do? How can the PHN help you fix it? So this is our Healthy Weight Initiative. This is our PHN. It's quite big. This was really interesting. I hope there's no government officials in the room here, but this is an interesting slide to say, the latest Australian data says that 63.4% of Australians are actually overweight and obese, and the Commonwealth are really happy if we achieve 71.4. 61.1. So if we can get our national target down to 61.1 as opposed to 63.4, are you happy with that? No. So that was an eye-opener for me. When we moved on, there we go. I'm not going to pick your PHN, I'll pick mine. We're the 3rd fattest. Yeah, not cool. We know that there's no single strategy, there's no silver bullet that can fix this problem. We've taken about 30 years to get to where we are, to be happy or unhappy with our weight. It's probably going to take us another 30 years to fix it. But if we don't action it, I believe as primary healthcare clinicians, if we don't start actioning it now, we're going to be like this in another 60 years. So the key points, we all know these, I'm not going to run through them, you'll get the slides, but what we have found in disadvantaged areas, lower socioeconomic areas, we see greater rates of overweight and obesity. An interesting story from one of our GPs in the Cessnock community where we went, he said, Mel, I'm really bothered by what happens, and he's chatting. He said, I had a young mother come in this morning with a 3-year-old, and she was over the moon excited because I call them sippy cups with your little kids. There was this plastic cup lid that sat straight over the top of a Coke can. Way cool, hey, because the kid didn't spill the Coke. Really? Your child's 3 and we're happy with a sippy cup. I won't talk to this slide either, but what I wanted to say was, in our data, because PHNs, we have a look at your de-identified data, but going into many practices, what I noticed was weight and measurement is the biggest piece of data that's missing. We're just not doing it. And why is that? Let me tell you what the clinicians said. Nurses say to me, I don't actually feel comfortable having a conversation with people about their weight. I'm not a dietitian. Okay. But you're a registered nurse, right? Or you're an enrolled nurse. You know, it's not rocket science, not asking you to give detailed nutrition advice to these people, but, you know, I think we can have that conversation. GPs, a couple of GPs said to me, oh, I feel really uncomfortable. You know, patient might come for a stub toe, or they're here for a flu shot, or, you know, something like that. I feel really uncomfortable bringing up people's weight. I'm quite good friends with this GP. I said, why? He goes, I don't know, I find it's a really difficult conversation to have. And this particular, Dr. Holly, me and him are really good friends. I said, Dr. Holly, it's interesting because if you were diagnosing me today with a terminal illness and essentially you were going to tell me that there was no other treatment plan for me, that you would help me and you would manage my death, right? Yes, he said. I said, well, that's exactly what you're doing when you refuse to weigh, measure me, or discuss my weight with me. You're doing exactly the same thing. Next slide. Okay, so what we wanted to do was develop a model of care that would work. Who's heard of Michelle Bridges? Okay, CSIRO diet. Yeah, all of those initiatives work. But what happens is we don't bring all the information or pull that information together at a local community level. The other thing we found was that GPs are, with a little bit of gentle persuasion, they're happy to run a program, and there's lots of programs that are running from the general practice setting where patients that are interested in addressing overweight and obesity or just changing their lifestyle, that they will come to you as a touch point over a 12-week program and talk to you about it, you know, and be weighed, be measured, be accountable. The other thing we've found sorry, I am a little bit lost because I haven't followed my slides, so is this okay if I just keep talking? Okay, so wrap me up, okay. The other thing we found was when we also engaged with allied health professionals, so I had lots of interviews and meetings with dietitians, exercise physiologists, psychologists. Who considers healthy weight could be a psychological problem? Yeah. We have to know the psychology behind why people are the way they are. They don't overeat or just because they want to, or they don't not exercise because they can't. Sometimes they've got that lack of motivation, or they're so depressed or anxious that they can't do those things. Really have to be thinking about the quality of our referrals. So one of the getting back to the EP and the dietitian, they're incredibly frustrated because do you know what we do? If we're not engaging when we're having those initial conversations with our patients and we simply feel okay to hand over an EPC referral, I still call them that, I can't lose that out of my head. If we just do that piece of paper and hand that referral over without getting the patient's buy-in, it's simply not robust enough. So guess what happens? They go for their first appointment with the dietitian and that first appointment is wasted. Because the dietitian's got to sit there to engage with the patient to go, so why are you here? And look, 80% of the time, the feedback is the patient goes, oh, no, the doctor sent me. It's not okay. Could you imagine if we start running an initiative from our own general practices where we are simply weighing and measuring every patient every time and getting early wins on the board with our knowledge, with our clinical knowledge to date, without us being dietitians, without us as nurses. We're not doctors, that's okay. If we can get early wins on the board, celebrate those early wins and then refer, how much more benefit is that going to be for our patients? And we'll get better outcomes. Skipping through there, activity to date, I've told you all of that, we've engaged with that. We've just started to do our community engagement. That's actually been quite challenging to date because people just don't want to come. The community don't want to come to our events. But we're going to change them up. So we've pulled it right back and trying to engage better with community established groups, so Lions clubs, Probus clubs, groups like that to talk to them about what are the issues in the local communities. So an example was the further northwest that we went, so in our hotter areas, Narrabri, places like that, they spent millions of dollars building a beautiful new public pool complex. I can't remember how many million, but a lot of millions of dollars. But they were then charging families $10 to get into the pool. So no one was going. And they can't run there, believe me. When I would go to Narrabri and I try to go for a run, I can't because it's like 50 degrees. It's crazy. So this is our activity to date. probably next steps, these are the points I wanted to take you to. What can you do in your practice right now? Weigh and measure every patient every time. Make it like this is normal. We're not singling the 35 kilo person out, or the nice trim 52, 58 kilo person. Weigh every patient every single time. Make it a part of your normal practice. Simply ask the question, are you happy with your weight? Because guess what? The person that's 56 kilos might be really struggling. They can be malnourished, they might be struggling with anxiety, depression, not eating, whatever. Ask the question, are you happy with your weight? That's not too confronting, do you think? I'd answer it. Who's been weighed or measured by their GP in the last 12 months? That's pretty good. I only weigh and measure myself at my GP because he's a very close friend of mine. I go, you need to be doing this every patient every time, and I have to do it myself. So I'd like to encourage you also to engage your patients early. Have these conversations. You are knowledgeable. You do have enough knowledge to be able to empower change and educate our patients. Celebrate their small wins and get that nice, robust referral happening before it happens. And you can go to our People Bank. We've got, you can give us any feedback. You can have a look at our program up on our PHN website. People Bank has been a great way to engage clinicians, community members alike, if they'd like to give us any feedback on what's working, what's not working for them in their community. And we're taking all of that on board to action local strategies in each of the areas we're going. That's all. Thanks. Questions? Don't make them too tricky. Any questions? Yeah, okay, so we sent out, we did poster, so flyers in each of the communities we were going. We spoke to engaged local councils to try and get some action in from their healthy lifestyle programs. We tended to find the community members that were coming were clinicians, so we didn't get the general community. One of the initiatives that happened in Wyong, we didn't, but another program had been to the community centre, which really targeted a lower socioeconomic area in Wyong, and they provided them lunch, and that was an awesome event. So I just think we missed the pitch, and we weren't, although we got some really good information of what was happening in communities, we didn't get the patient experience. So we're going to go back and reevaluate that and do it again. We even broadcasted over one of the local clubs that we were in to go, would anyone like to come? But they were doing bingo and stuff. Is there any more questions? No? Good.